Good afternoon, everyone. Thanks for coming. Today, I want to talk about the development of varicose vein treatment, Chinese experience. I'm Dr. Zheng from Beijing. I'm really sorry for my internet, and also I want to express my thanks for Professor Whitley, Professor Tang, also my equal colleagues. This year is quite unusual. I want to share these pictures with all my colleagues, over the world, from Wuhan, from United Kingdom or Singapore. We are suffering from the coronavirus disease. Some of my colleagues they stayed in Wuhan for several months. They're still there. So our team are just fight against the coronavirus disease. We look forward to their comeback. And now, firstly, I want to report the rapid development of vascular surgery in China. As we best know that vascular surgery department has become an independent discipline in many hospitals all over China. We have a lot of vascular surgeons. They focus their jobs on the aorta, venous disease, chronic wound VT, and so on. We also some clinical nurses, specialists. Till to know, we have more than 3,000 vascular surgeons in different levels of hospital in China. So vascular surgeons in China play more important roles compared with radiologists and cardiologists in other countries. I'm heard from my friend from Europe or South Korea or other countries. So vascular surgery department has greatly become the main force in hospital in China. And I want to show you Peking Union Medical College Hospital. This hospital I really proud to be one member of this hospital. This hospital is founded in 1921 by Rockefeller Foundations. Till to know, this hospital is still considered one of the best all over the Asian Pacific regions. So that's our department. Our vascular department has one ward with 46 beds. We have 2 one-step hybrid operating theaters. Yes, also our doctors were divided to 5 surgical teams. Okay, Professor Ye is one of the leader of venous disease groups. So varicose veins, CVI, and a lot of venous disease were performed in Professor Ye's group. Also, other doctors have their interest in aorta or carotid artery and so on. Okay, I want to tell everyone varicose veins surgeries in these recent years. Like this table, we can find that we can perform over 700 cases per year. Mostly are radiofrequency ablations. We also focus on the perforated veins of these years in our centers. So radiofrequency ligation, stripping, or perforated are we most pay attention about this. All the patients who suffer in varicose veins accept day surgery in our centers. We only have 3 beds for this kind of patient, and our department, we performed 700 surgical cases each year. So we must try to process this patient in 1 day. So it's necessary to optimize the operation process. With the cooperation of doctors and nurses in our department, we use this table, this process to do our jobs. Although the development of vascular surgery in China, there's still a limitation of medical consumables. As we best know that the venous disease, we have a large population in China. We have a lot of patients who are suffering from venous disease. And we also have many therapies that also included traditional Chinese medicines. So as to the venous disease, I think it's okay. As to the arterial disease, due to the limitation of the Chinese FDA, we still lack of some new device, especially in the aorta device. For example, when we perform some procedures at the thoracic abdominal aortics, we don't have penetrating stent graft, so we must make a physically modified device. So that's very regret for it. Okay, as just mentioned, Professor Whitley mentioned the thermal therapies of the radiofrequency ablation. The radiofrequency ablation was conducted in 1998, and this tube will transmit heat directly to the venous walls. So the vessels in the thallium cells fall off and create a quick fibrosis to the venous lumen. Also, added to the radiofrequency, the second generation catheter is currently in use in the South China. We call it venous shell. And in 1999, the laser use was first reported by Prof.Yuehong Zheng. So this kind of electromagnetic thermal effect of light wave is targeted molecules and absorb the light wave of a particular wavelength. This laser energy is absorbed and converted into heat energy. So endothelin cells are destroyed after the venous walls is heated, and secondly, the thrombosis leading to a true luminous occlusion. We can compare with radiofrequency ablation or the laser therapies. There are quite different between their occlusions, I think. So finally, I want to introduce the thermal therapies. Let's call the Endovenous Microwave Ablations. So this corporation, EVLT, has this kind of products. The mechanism of the microwave ablation is use under the ultrasound guide and the local anesthesia. We use with the catheter. We put the catheter into the lumen of the golden saphenous veins and inject some fluid. So microwave can create heat and finally occlude the vessels. Okay, added to the varicose veins, it's a worldwide problem, I think. In the United States, in the Europe, the mortality of the varicose vein is in high possibilities, and lifestyle changes contribute to the increased number of peripheral arteriosclerosis disease, also the venous disease. The proportion with the venous disease is higher, and the condition, for example, the chronic venous insufficiency is more common. So it's calculated more than 190 million people have either venous insufficiency or varicose veins worldwide. And what's the reason? Who caused the varicose vein? Yes, we conclude the risk factors that include age, family history, deep venous thrombosis, obesity, or long-standing postures, or pregnancy and genders. We also find other possible factors, maybe the reason of varicose veins, that include smoking, hypertension, oral contractives, HIT physical activities, or constipations, and so on. I want to introduce the pathophysiologies of the varicose veins. Yeah, it's kind of dysfunctions of great saphenous veins, the valve, the vessels walls of the venous. The blood flows wound, resulting in decreased local vein pressure, which become prolonged, gradually dilated, and tortuous. Firstly, it's kind of dilation, first occurs in the valves, and then subsequently we have two form of change. It's kind of granular circular or tumor-like dilation. And as a vascular surgeons, I'd like to use CEAP classification systems. That's clinical etiologies, anatomies, pathophysiologies. This classification system, I think, was first proposed by the International Special Committee of the Report of American Venous Forum in 1994. This classification system is not the most widely used method in clinical practice after being revised for several times. So, superficial varicose veins affect patient quality of life and may progress to serious illness. So finally, we should treat the varicose veins. Surgical treatment for this, we have a lot of methods that include two main methods, atrial cavity treatment and endovascular treatment. Or atrial cavity treatment that include traditional method is high ligation and stripping of great saphenous veins. We call the traditional surgical method. Also, we use luminal port phlebectomy tips. Also, we use Chiver. Sometimes we use SEPs for endoscopy-assisted perforated venous dissections. But no, we'd like to use endovascular treatment that's minimally invasive, I think, that include endovenous laser ablations, radiofrequency ablations, and also foam sclerosis treatment. As the chairman of Chinese Society of Microcirculation, my team have a questionnaire about the varicose veins surgical medicine in China. We researched more than 511 hospitals in China, that's from more than 30 provinces, municipalities, and autonomous regions. We recruited more than 90,000 varicose saphenous veins. That's all. This table is kind of a distribution of age and gender. From this table, we can find that the patient suffering from varicose veins from the age, mostly from the age from their 50s to 70s. There were little difference between the genders. Also, what kind of surgical procedures among the patient in China? From these tables, we can find that the most commonly used varicose vein surgery method is still the traditional one. It's ligation stripping. It's mostly used. Also, we also use the laser, the sclerotherapy, or the radiofrequency. Sometimes use the microwaves for this patient. Let's have a look at the result in this recent 3 years. That's the Chinese result, I think. From the total number of varicose veins surgery performed, didn't change significantly. We can still find a trend. The number of traditional ligation stripping generally decreased, and the number of minimally invasive surgery decreased a little bit. So minimally invasive surgery, that was laser, forming, and the plus were becoming both increased from year to year. The surgical benefit, high ligation ramp has the longest hospitalization stays. They are a little bit longer stays than the minimally invasive method. And our surgical benefit is minimal invasive method is more expensive. And okay, so when we treat the varicose veins, we under the guideline of the Society of Vascular Surgeons and American Venous Forum Clinical Practice Guideline. This guideline is really useful, I think. From this, the laser and radiofrequency ablation, the thermal therapy is strongly recommended. They are grade 1 and the level evidence is B. Also, with lower complications, less suffering compared with other options. And endothermal ablation is recommended instead of forming sclerotherapies. Also, we have a look at the 2013 National Institute of Clinical Excellence, NICE. As the interventions for varicose veins or triangle reflex, the following treatment high rank is recommended. The endothermal ablations is much recommended more than the surgeries. As to the compression hospice, yes, compression hospice should only be considered as the treatment options if the intervention therapy is not suitable. I introduced some Chinese expert vascular surgeons. They focus on the therapy of varicose veins. There's Professor Mei Jiacai, Wang Haiyang, and so on. They are the experts of our committee of vascular varicose veins, and they organize more than 200 specialists to do one thing. They hold meetings. They can do guide some young doctors, and also they give some trainings to other hospitals. I really want to thank all these colleagues from Tibet to Hainan to Harbin, a lot of countries. They do a lot of jobs. And finally, we also have a guideline we call the Microcirculation Specialist Consensus on the diagnosis and treatment of superficial varicose veins of lower limbs. This consensus was published in last year in a Chinese journals, and I think it is really helpful to young Chinese doctors when they perform operations for the varicose veins. So with the effort of my circulation specialist, the consensus on the diagnosed microcirculations of superficial varicose of lower limb has been made. There are many mostly invasive methods for the treatment of the superficial varicose veins of lower limbs, and these should be applied in accordance with each patient, according to the patient and their different condition. It's better to choose different ones. We also invented one kind we call the 1, 2, 3 target regimen method. I think it's really helpful. It's my recommendation for this. So strive to achieve more minimally invasive, more radical treatment is really helpful for the treatment of the varices of great safeness with. To bring help and convenience for the work of everyone, we hope to promote the standardization and diagnosis of superficial varicose of the lower limb in China. So finally, I think we should still think of some things, especially about our venous vascular field. So how to renew the concept of the varicose veins? What kind of method is best? We have so many doctors and nurses. They are from different hospitals with different trainings. So sometimes the prognosis of is unpredictable. Why? So we still have a lot of things to do as to the vascular surgeons in China. For the development of the treatment of the varicose veins, we should do a lot of things, I think. Okay, finally, I'll give a very brief conclusion about my lectures. Venous disease, as we best know, especially in China, we have big populations. We have a lot of patients. They are suffering from venous disease. And a lot of methods. We should choose the best method. Until to know the traditional ligation and stripping is still the most widely used medical procedure in China. And the most common surgery, ligation stripping, the laser therapy, the foaming sclerotherapy are prevalent in China. Intracavity thermal ablation is safe and effective. In the doctors in Beijing, Shanghai, and Guangzhou, most prefer to use this kind of method. For patients with varicose veins, endothermal ablation is strongly recommended in these regions. As to the rural regions, I think some patients may be money and other things. Traditional therapy is still useful. I want to see the Chinese Society of Microcirculation has played a more important role in promoting standard treatment of varicose. Also, finally, I will look forward to the further communications with all of you, especially in the field of venous disease and varicose veins. Okay, finally, I want to say thank you. Thank you, everyone. Welcome to Beijing. Thank you.